4, how COVID-19 affects pregnant women, breastfeeding women, and children. And so, you have to protect yourself and your baby from COVID-19, and that means getting the vaccine. The COVID-19 vaccine is recommended for people who are pregnant, breastfeeding, or trying to get pregnant or might become pregnant in the future. Benefits of receiving the COVID-19 vaccines outweigh the potential risk of vaccination during pregnancy. Therefore, it's currently no evidence that any vaccine, including the COVID-19 vaccine, can cause problems trying to get pregnant. And COVID-19 vaccinations in people who are pregnant or breastfeeding builds antibodies that might protect their baby. And we'll talk about more of that. The learning objectives here, after this module, you should be able to educate people on the availability of COVID-19 vaccines for pregnant and breastfeeding women and children, describe how COVID-19 affects pregnant and breastfeeding women and children, educate people on how pregnant and breastfeeding women and children can avoid getting COVID-19, and of course, understanding community concerns and provide relevant responses and care. Pregnant women are at greater risk for COVID-19 infection or infections in general. Pregnant women are at greater risk for some infections due to the pregnancy induces a shift in the immune physiology of the woman, of the person. This adaptation allows for a fetus to be protected from an immunological rejection by the mother. However, this adaptation during pregnancy put the mothers at greater risk for all types of infection, especially respiratory tract infections. In addition, the cardiopulmonary adaptations during pregnancy to accommodate the developing fetus also increases the mother's susceptibility to life-threatening respiratory tract infections, including COVID-19. So, COVID-19 vaccines in pregnancy. Vaccines are recommended for all pregnant women. Getting the vaccine is the best way to protect the mother and the baby from COVID-19. There are no safety concerns, and there are no evidence that the COVID-19 vaccines increase risk of miscarriage or stillbirth in pregnant women. Pregnant people are at higher risk of serious illness and complications of COVID-19 if they're unvaccinated and acquire COVID-19. Protective antibodies can pass from the mother to the baby after vaccination, protecting them both. And of course, if you're breastfeeding, you can still receive COVID-19 vaccines while you're breastfeeding, and there's no evidence that COVID-19 vaccines can affect your fertility, and that's for both men and women. What we know is that pregnant people with symptomatic COVID-19, 70% of them at increased risk of death. COVID-19 during pregnancy increased the risk of adverse pregnancy and poor neonatal outcomes, including preterm birth and admissions of the baby to ICU. Only 31% of pregnant women have been vaccinated against COVID-19. Today, that number is closer to 45%, meaning that there's work to be done in terms of vaccinating all pregnant women against COVID-19. Hospitalized pregnant women with COVID-19 can have severe illness. About half of the hospitalized pregnant women with COVID-19 had symptoms. These symptoms slow the spread and protection, and you have to slow the spread and protect yourself by getting vaccination. So some hospitalized pregnant women who had symptoms have had severe outcomes, that is include ICU administration, mechanical ventilation, and death. So pregnant women should wear a mask when they're out in public, stay 6 feet apart, wash their hands, continue to receive prenatal care, and most importantly, get vaccinated for COVID-19. And so most pregnant people with COVID-19 do not have complications. However, COVID-19 can lead to more severe illness in pregnant people compared to non-pregnant people. And of course, there is a health disparity. Hispanic pregnant women are 6 times more likely than white non-Hispanic pregnant women to have COVID-19, and Black and non-Hispanic pregnant people are 4 times more likely than white non-Hispanic pregnant people to have COVID-19. So again, wear a mask, social distance. If you have symptoms, get tested. Continue to receive your prenatal care. and you must consider vaccination against COVID-19. So the outcomes of pregnant people. They've examined 1,400 plus pregnant women in this study that were hospitalized for COVID-19. 1 in 3 developed pneumonia and needed mechanical ventilation. 1 in 6 were admitted to ICU. 1 in 100 died, and 9 out of 10 of these individuals that had the problems were unvaccinated. And so this stresses the importance of being vaccinated if you're pregnant for COVID-19. Risk of complications and death if you're pregnant, get COVID-19, and you're unvaccinated is severe. Pregnancy outcomes. 1 in 5 children are born prematurely. 1 in 50 result in stillbirth, and 1 in 50 results in a miscarriage. Okay, so over 84,000 pregnant people in the UK had been vaccinated. Vaccines are safe and effective against COVID-19 in this study. So the National Prenatal Association looked at coronavirus, and according to data from the Lancet, pregnancy and the risk of vertical transmission is very low, about 2 to 3%. And again, according to data in the Lancet, even mothers were infected. No virus was detected in nasopharyngeal swab of the baby, amniotic fluid from the baby, the cord blood, or the breast milk. And so even in the infected mothers, the risk for the baby is small, but however still there. So breastfeeding and COVID-19. Breastfeeding to protect infant and children from getting sick for their health, growth, and development is very important. Breastfeeding is particularly effective against infectious disease because it strengthens the immune system, and you have the transfer of antibodies by way of breast milk to the baby. Women with COVID-19 can breastfeed if they wish to do so, and they should. Again, while they're doing this, they should practice respiratory hygiene and wear a mask. They should wash their hands and routinely clean and disinfect surfaces. So a woman with COVID-19 should be supported to breastfeed safely, and of course, allow skin-to-skin contact with the baby in the labor and delivery as well. Breastfeed often, wear your mask, keep breastfeeding, and of course, wash your hands. And again, if you must go to the hospital, keep the baby with you and keep breastfeeding if you can, and so forth. So breastfeeding the baby is very important. And of course, if you're breastfeeding, you can still be vaccinated if you're unvaccinated for COVID-19. And so, as we said before, it's very important to breastfeed. And again, breastfeeding while you get the COVID-19 vaccine is not a problem. There's found no evidence of virus in the placenta in any serious way, nasopharyngeal swabs, cord blood, and so forth. And so vertical transmission of the virus, if you're infected to the baby, is relatively small, but again, still problematic. So the COVID-19 vaccine can protect you and your baby by transfer of antibodies via the placenta and breast milk. And what you have here, by way of pregnancy, if you get the vaccine, in this case, the mRNA vaccine, what happens is that in the maternal blood, you produce antibodies that can be transferred by way of the placenta to the baby, the developing fetus. Once the baby is born, the antibodies from being vaccinated can be transferred to the baby by breastfeeding. And this is what it says here. Again, this immunity over time will wane as well. And that means that when the baby comes of age, and for age for eligible vaccination would be 6 months, the baby should be vaccinated. And so the number of weekly COVID-19 cases reported in children in the United States, this is quite serious. So we look at the beginning of the pandemic, and that is June 2020, okay? and we go all the way to January 2022, what we see is that we experience surges during that time. But what we've seen recently is the highest increase in the number of children reported to have COVID-19. Again, this is quite serious. And so when we look at COVID-19 hospitalizations for children and teens, what we see clearly is that the Omicron variant has resulted in an increase in hospitalizations among children and teens at the highest level we've seen since the beginning of the pandemic. And of course, the best way to protect your child is to get them vaccinated as soon as possible. So here, what we see is the age of children during the Omicron surge that, again, more than likely, these infections of the Omicron across all of the age groups. And again, you saw increases in children of different ages. So particularly between ages 1 to 4. And so when you look at this, you see ages 5 to 11, 12 to 17, 1 to 4, 18 to 49, and so forth. And so you can see that there has been an increase due to the Omicron surge in terms of infections in children and hospitalizations among children. So 4 things you need to know about multi-system inflammatory syndrome in children. This is a condition that you find in some children that get COVID-19. It appears to be a rare condition in children. It may show up weeks after COVID-19 infection has passed. And again, it causes inflammation in multiple organ systems. You can see it on the skin, you can see it in the eye, you can see the eyes being red. And again, many internal organs undergo inflammation as well. It can produce high fevers, abdominal pain, neck pain, rashes, bloodshot eyes, and diarrhea in these children. And so this is a condition in children that can occur weeks after COVID-19 infection. And so this is very similar to Kawasaki disease and pediatric inflammatory syndrome associated with COVID-19. And of course, this is rare. This is a multi-system inflammatory process. They have persistent fever. They have no other known infections. They can have organ dysfunction. They can have elevated inflammatory markers and cells. And you can see the skin rashes. They can have diarrhea. And of course, they can be PCR positive or PCR negative as well. In summary, the current knowledge of COVID-19 in pregnant women and children can develop severe disease after infection. Pregnant women are at increased risk of hospitalization, intensive care admissions requiring mechanical ventilation, and preterm birth compared to uninfected pregnant women. The virus has not been found in nasal swabs, cord blood, amniotic fluid, or breast milk, so it's not known to be spread through childbirth or breastfeeding. And yes, babies can still receive breast milk even if you test positive for COVID-19. The breast milk is safe and important for the baby. Children with underlying medical conditions and those that are obese are at high risk of severe COVID-19 disease. It is important that pregnant and breastfeeding women, children, and their caregivers take extra precautions to avoid getting sick and spreading the virus. Providers working in maternal and childbirth programs should provide additional education to these target populations to encourage pregnant women, breastfeeding women, and children to get the COVID-19 vaccine and boosters. Next module. Module 5, Nutrition and COVID-19. So these are the 10 immune boosting foods. And the idea is a proper balanced diet, proper sleep and exercise results in a robust functioning immune system. So you can see some of these foods here. Hopefully you're eating some of these foods on a regular basis. And again, you wouldn't want to start eating these foods once you get COVID-19. It's best to have your immune system prepared prior to infection. And so wearing your mask, mitigation strategy, washing your hands, you could avoid COVID-19 as well as being vaccinated, which is most important. But eating a balanced diet, and you can see all of these foods here have important nutritional qualities to support a strong immune system. The learning objectives here after this module, you should be able to understand how nutritious food can help a person stay well and defend against illness. Identify foods and supplements that can support the immune system. Identify foods that can support lung health. Identify those foods that represent a poor diet that could lead to chronic disease that make you more susceptible to severe COVID-19 disease. So junk food and obesity infographic. 80% of people eat junk food on a daily basis. That's a lot. 360,000 Americans die each year from disease directly related to obesity and an unhealthy lifestyle. And again, when we go back in the day, all the way back to 1980, and we compare the number of children walking to school on foot to those in 2015, you can see there's a considerable difference here. 20.2% walked to school every day on foot in 1980, and in 2015, only 8.3%. Well, what they're saying here is that children don't get enough exercise. And again, remember, walking to school and then walking back home, that would be regular exercise every day for children. And again, with our fast lifestyle and having to be on time at different places, we don't do that very much anymore. Only 19% of people get the recommended amount of physical activity every day as well. So what we're saying is that our lifestyle and what we eat and the exercise that we don't do can contribute to an immune system in a person that can have greater risk at developing some of the most severe complications to COVID-19 if they were to become infected. And we know that obesity is a factor when it comes to people having severe disease associated with COVID-19. Overweight by ethnicity and race, we can see Hispanic, Latinos, and African Americans, along with Pacific Islanders, whites, and Asians. Okay, so again, ethnic minorities have more of a problem when it comes to overweight by ethnicity and race. In terms of calories consumed per day by adults, you see. So think about it. Back in the day, 1980, I think it was, 1,990 calories. 2000, 2,300 calories. 2015, 3,000 calories. And of course, 2022, it's going to be more than that. So the main sources of empty calories, and we all know what they are, and some of them are here. And again, some of these are not empty calories, but the main sources of, I think, red meat and fried foods, yeah, those can be problematic if done in excess as well. So every fifth child in the world is overweight or obese. That's quite serious. And so, again, lifestyle changes are very important for reducing your risk for severe disease associated with COVID-19. And so when we look at consumptions of unhealthy food that rose during the pandemic, what is very clear is that they looked at almost 4,000 US adults and asked if they were consuming unhealthy foods, sugary drinks since the start of the pandemic. And you can see here, there was an increase in terms of always, sometimes, and never, okay? And of course, consuming more unhealthy foods and drink was higher among younger people, racial and ethnic minorities, adults in lower socioeconomic status, and adults with obesity. And of course, if you continue long term, this can lead to metabolic changes that can result in chronic disease that again puts you at greater risk for the most severe complications of COVID-19. So in terms of the immune system, there are some immune boosting minerals that a person can get from the foods that they eat. And so you can see them here: zinc, vitamin C, iron, vitamin E, vitamin A, and vitamin B6 from all of these foods that are loaded with protein as well, and other vitamins and minerals. So eat more of these for your health and wellness. So foods healthy for your lungs, okay? Drinking water, certain types of citrus fruits, peppers, beans, carrots, onions and garlic, turmeric, and so forth. So incorporate some of these fruits and vegetables into your daily routine and improve your diet. And of course, along with exercise and proper sleep, this goes a long way in being able to help you defend yourself against infections. Again, basically boost your immune functions. So foods that are inflammatory in nature, okay? So the anti-inflammatory foods that would include tomatoes, fruits, nuts, fatty fish, leafy greens, and olive oil. And again, you should try to avoid inflammatory foods that includes fried foods, soda, refined carbohydrates, lard, and processed meats. And so what you want to do is replace some of the inflammatory foods with anti-inflammatory foods. And again, along with diet and exercise and a proper sleep, it does a body well when it comes to preventing infections. A new diet for those that are newly pregnant. You can see here some of the better things to eat and some of the bad things to eat. Okay. And so what we saw during the pandemic is an increase in supplement consumptions worldwide. And so you can see here that more people began to take vitamin C and vitamin D around the world. And of course, the top 10 supplements increased during the pandemic. Many people started to take a multivitamin. And again, you see vitamin C and vitamin D. And again, sometimes these supplements can be part of misinformation, saying that I can supplement a diet like vitamin D and not get the vaccine and not worry about contracting COVID-19. This is misinformation. There's no way that just taking one vitamin is going to be enough to prevent you from getting COVID-19 if you're exposed. And the idea is that coming up with one medication or one particular holistic approach to preventing COVID-19 by drinking juices from boiled leaves or doing any kind of holistic concoctions would be ill-advised in terms of as a prevention tool for COVID-19 or as a treatment option for COVID-19. So using any of these in terms of therapeutic intervention once you've gotten COVID-19 is ill-advised. And again, what you'd want to do is get vaccinated. And that would be the best thing you can do, along with the general multivitamin, as opposed to some of these other things. But again, you wouldn't want to use this as a therapeutic or as a prevention, a prophylactic against getting COVID-19. So there are some homeopathic agents that are out there. There's going to be many people that claim that they have something, that if you take this one pill or this one leaf or this one juice, that you don't have to worry about being vaccinated or getting COVID-19, or take this and you'll prevent post-COVID syndrome or long COVID. Again, these are things that people that are trying to push this and this false narrative that they have something that can cure all when it comes to COVID. This is also ill-advised. In summary, when educating others on their nutritional health, make sure to share accurate, relevant, and easy understood information. Focus on appropriate amounts of these foods and supplements, since overdosing does not provide additional benefits and could be harmful. Taking mega doses of vitamins can be harmful, especially if they are fat-soluble vitamins that do not pass easily in the urine after taking excess amounts. To reduce panic, emphasized that diet is only one factor in a person's immunity and should be paired with self-care, good hygiene, physical activity, and adequate sleep. Next module, staying positive and taking care of your mental health. During the COVID-19 pandemic, many people developed anxiety, stress, panic, depression, had phobias. They had grief because they lost loved ones. And so all of this together can be difficult to manage. Being able to manage your mental health through a crisis like a COVID-19 crisis that has been ongoing now for about 26 months and has never let up. And many people have been lost to this disease over time in many different ways. Loss of life, loss of vitality and function. Some people having brain fog and fatigue that have prevented them from going back into the workplace. This has been difficult, and this has been a problem not for just individuals, but for families. Learning objectives after this module, you should be able to understand concerns people have for their mental health and wellness, know some things people can do to cope with the stresses and anxiety that's associated with this pandemic, and when they should seek help for mental health and wellness. And so when we look at COVID-related worries of 3,042 responders to this survey, many of them had concerns about their family getting COVID-19, unintentionally infecting others, financial burdens after the pandemic, okay? Because we know that a long illness that requires hospitalizations can produce financial burdens that are difficult to overcome. Many people were concerned about just getting COVID, the anxiety. You're sitting there, you're older, and you have a number of underlying health conditions, and you're around people that are getting COVID and dying. The stress of looking at that and thinking about that all the time can be problematic. Dying from COVID-19, not having COVID, now having COVID-19. And of course, gender differences as well. So females, you see an increase in females concerned about the family getting COVID-19, females unintentionally infecting others. So you can see that women were more prone to be concerned for the family and for their associations with getting or dying from COVID-19, about equal when it comes to financial burdens. And of course, when you look at the rate of worries that people had for certain worries, by way of age, you can see that younger people had a lot of worries when it terms of getting COVID and unintentionally affecting others and so forth, and now having COVID. And so again, so lifespan differences, gender differences, and worries concerning COVID-19 across the board was problematic for a lot of people in this survey. And so when we look at this, approximately 1 in 5 adults aged 18 and over have health conditions that might be related to a previous COVID diagnosis. So if you've had COVID leaves your body in ways that it wasn't before. So you can have lingering symptoms, you can have abnormalities that persist, you can have damage in the body that can be long-term. And what you see here is neurological and mental health conditions that can be long-lasting after COVID. Kidney failure after COVID is something that happens with some people, requiring dialysis or kidney transplantation. Musculoskeletal conditions that persist long after COVID is gone. Cardiovascular conditions where people will develop arrhythmias associated with COVID-19. Long-term respiratory problems, some people a year after having COVID have chest pains when they walk upstairs. Blood clots and vascular issues in people that have COVID. So again, some of these are associated with long COVID. Some of these are just persistent abnormalities that are around long after COVID is gone. So adults with disabilities report more frequent mental distress, almost 5 times as often as adults without disability. So if you're there with a disability, first of all, you probably have less interactions with other people. You have to do a lot of things on your own. You may be concerned with getting COVID-19 and not being able to help yourself. And of course, you might have needs that are not being met. And of course, people with disabilities, especially it could be a mental disability, could be confused at a time of crisis. And that's all problematic. And so people need to be screened, particularly people with disabilities, for mental health concerns. And so even when we talk about young people, they're more likely to report symptoms of anxiety or depression associated with COVID-19 by age here, younger people. So younger people are going through this. And the idea is that younger people are very social, and having to stay home, be isolated, stay away from school and their friends, this can bring on, feelings of anxiety and stress and depression. And this was more pronounced in this study in younger people 18 to 24 years old. Pandemic can cause spike in anxiety and depression. And again, this is about a year apart here. And he looked at symptoms and anxiety disorders. And you can see before the pandemic and during the pandemic, you saw increases in symptoms of anxiety, symptoms of depression, and symptoms of anxiety or depression disorder in those individuals. This is the percent of US population's adults showing symptoms of anxiety or depression disorders. So you can clearly see here that there are concerns people have, and they have been expressed in ways of reporting anxiety or depression during this time. So, mental health and suicidality. So 1 out of 3 students had poor mental health during the pandemic. 2 out of 5 students felt emotional distress during the past year. And of course, 1 out of 10 students attempted suicide during the past year. So poor mental health and suicide attempts were less common among students that felt close to people at school. And you can see their social networks have been disrupted by the pandemic. Many people depend upon their social networks for mental health and well-being. And when that is disrupted, this can bring on anxiety, depression, and feelings of suicidality that can persist in these populations. And again, they should seek mental health and be screened for mental health illness. So CDC data on youth mental health during the COVID-19 pandemic. 37% of youth experienced poor mental health during COVID-19. 44% experienced persistent feelings of sadness, hopelessness during the past 12 months. And so again, going to virtual school, being isolated from friends and family, not being able to get together in large gatherings, not being able to go to concerts and live appearances and functions. This together can be problematic for young people and can result in mental health deterioration. This is data gathered by the CDC looking at youth that encountered challenges that youth have encountered during the pandemic. 55% reported they experienced emotional abuse by a parent or caregiver. So when a person is at home all the time and not at school, there's going to be heated exchanges that can occur between parents, caregivers, and children. And that's always problematic. 29% reported a parent or other adult in their home lost a job. So the loss of a job impacts the financial well-being of a family. It changes things for everybody. Many people may have to go out and get more than one job. Many people may be underemployed during this pandemic, and wages are lost. Some people may lose their insurance. All of these things can impact the family in a negative way. Report they experience physical abuse by a parent or caregiver, 11%. And again, stresses that are brought in by the pandemic affects everyone in the family, and oftentimes that can lead to violent behavior. During the pandemic, girls ages 12 to 17 had more emergency department visits for some mental health conditions. And again, some visits for eating disorders, and again, that increased with the COVID-19 visits. And of course, comprehensive efforts are needed to prevent, identify, and address mental health conditions among children and adolescents during this time. Lesbian, gay, and bisexual youth experience worse mental health threats during the COVID-19 pandemic compared to heterosexual youth. And it's very clear here. And again, feelings of isolation, hopelessness, and of course, many of them having to go from college back home and have to oftentimes experience stigma and discrimination from people that know them, as opposed to being at college where they can meet up with their friends and they share with shared experiences. They may be better off in terms of their mental health and wellness. Share of parents reporting worsening mental health for their child age 5 to 12. You can see during this period of the pandemic, worsening of mental health, elevated symptoms of depression, elevated symptoms of anxiety, elevated symptoms of psychological stress. This is a report put out by the Kaiser Foundation in 2021. And so even young children that are very social, that depend upon the socialization that they get when they go to school, as opposed to staying home and being isolated away from their friends, you can see it in this kind of a report. So the tips for positive mental health during the COVID-19 pandemic, things that you should do include positive thinking. You can actually exercise, that would be helpful. A balanced diet, relaxation exercises, regular daily routine, socialization online as opposed to in person, taking a break from your routine work life, and other healthy lifestyle choices. Meet outside, read a book, that kind of thing. Don'ts, substance abuse increased during the pandemic. People ate too much fast foods during the pandemic as well. Excessive online activity, excessive watching television, mostly news that encouraged feelings of anxiety and depression. Travel, partying, focusing on negative aspects of the pandemic, posting about COVID on social media and spreading fake news, misinformation, and conspiracy theories, believing fake news, and so forth. And so the idea is that there are many things you can do to support your mental health and wellness during this time. The vaccine has allowed us to go back to a level of normalcy in many different ways. We are back in person at work and at school. There are some restrictions that have been lifted when it comes to travel and interactions, even masking. But again, what we know from the past 2 years, more than 2 years now, is that there are changes in this pandemic that requires us to change as well. We will oftentimes see changes in CDC mitigation guidelines for operations during this pandemic, and we should stick to these changing guidelines based upon the level of community spread during the surges of these particular variants, particularly the B4 and the B5 variant that is now in circulation in the US. Coping with COVID-19, and again, take breaks from the news. Make times to unwind, set goals and priorities, take care of your body, connect with others, and focus on the facts. So if you listen to the facts, what you know is that the vaccines are effective, they're available, they're free, widely available. They will prevent you from developing severe disease and hospitalizations, ICUs, and so forth. Taking these vaccines, when you look at the data, The clinical data supports the notion that these vaccines have been safe and effective. Vaccines in general have been safe and effective for decades. They are among the most highly scrutinized medical interventions that we know. We know that children have a lot of experience with vaccines, particularly at their school age. Because to go to school in the United States, you have to be vaccinated every year, and it's mandatory. And of course, mandatory vaccination among students have happened for the longest time. There have been few and far in between adverse events associated with regularly scheduled vaccines for children over time, over decades. And again, vaccines have allowed us to live 30 years longer than we did 100 years ago. They have proven their safety and efficacy over time, and these vaccines are no different. There are some side effects. However, these side effects are very rare. Caring for your mental health during the COVID-19 pandemic, take that break. Take care of your body. Know the facts. Stay connected. And of course, ask for help from a mental health provider when conditions become overwhelming for you. Mental health and wellness, create that routine. Don't ignore how you feel. Make time to enjoy things. Start small by adding existing habits. Talk it out with friends and family. And of course, if you need it, a mental health provider. COVID-19 got you stressed. You can take classes online. Classes that will help you manage your stress. Yoga. And of course, do things in the home. Hobbies, craft projects, a board game, a movie night. Learn how to play a musical instrument. All sorts of things like that can be helpful in managing stress associated with the pandemic. Coping with quarantine fatigue, many people are exercising. And when you went to the store and tried to get exercise equipment, it was all gone because this was a habit that took off during the pandemic. Calling loved ones, not meeting in person, eating healthy. And again, the vaccine has basically done away with a lot of this. People can exercise in communal facilities. You wipe down the bench and you keep exercising. So the vaccine should be prioritized during your interactions with community partners. How to support your child mental health and wellness. Okay, be there for them. Show them that you care and love them. Support and encourage children. Get to know how your child is feeling about this pandemic. Exercise with them. Read a book with them. Coping. Okay, help your child with simple coping skills. Okay, encourage conversations about this. Listening to what they have to say. Keep an eye out for changes in their behavior. Okay, and again, control their wake and sleep times. Okay. What you can do to cope is to be active, to stay connected, find a balance, be kind to yourself, take care of your body, and reach out for help when needed. Summary: the COVID pandemic has changed our daily lives in so many ways and has caused us a lot of stress and anxiety. We must prioritize our mental health and wellness by doing things we enjoy. The COVID-19 pandemic has allowed us to enjoy most of our normal activities with the vaccine, and have been vaccinated is essential for our mental health and wellness. Family gatherings, vacations, hobbies, and some things that will help to heal the loss and fear we are experiencing during this crisis. Get the help that you need from trusted sources.